Hello, my name is Nurse Pauline RN. Welcome to my channel. Before I get started, please hit the like button, please subscribe, and please share this video. The topic of my video today is Fundamentals of Nursing, Exam 1, and we are on Part 6. We will be doing questions and answers today. My first question is, what are your two patients' identifiers? You enter your patient's room and you take a look at their ID bracelet. What are your patient's two identifiers? The answer is the patient's full name and the patient's date of birth. When you're assessing your patient's IV sites, what are you looking for? You are assessing for signs and symptoms of infection, signs and symptoms of phlebitis, assess fluid leaking, redness, pain, tenderness, swelling, warmth. Do you know how to assess your edema? Do you know how to grade your patient's edema for documentation? Okay, your edema for 1+ is 2 millimeters rebound. 2+ edema is 3 to 4 millimeters when you depress that. 3+ edema is 5 to 6 millimeters. 4+ edema is 8 millimeters. Don't forget your patients who have a history of breast cancer surgeries. Don't forget to assess the arm for lymph edema. What will you assess for your stage 1 pressure ulcer or stage 1 pressure injury? What does it look like? Stage 1 is a superficial reddening of the skin. When you press the skin, it does not turn white. That is your stage 1 pressure injury. Where will you look on your patients to assess your pressure injuries? Which sites will you look at? You will assess your pressure injuries in the hips, heels, elbows, head, ankles. Turn and reposition your patients every 2 hours. The doctor has ordered a wet to dry dressing. Do you know what to do? You'll have a sterile glove, you'll have sterile water, and you'll have your sterile gauze. Just moist your sterile gauze and place it on the wound. Once the gauze is removed, necrotic tissue or devitalized tissue is removed with gauze dressing when it is changed. When you have an alcoholic patient, what do you assess for your alcoholic patients? You will assess your patients for withdrawal symptoms. Assess your alcoholic patients for signs and symptoms of seizure. All alcoholic patients are on safety precautions. Alcoholic patients should have someone walking along with them because they are at risk for seizures, they are at risk for falls. Do you know what a PCA pump is? A PCA pump is a patient-controlled pump. For a PCA pump, patient control pump, the patient administers his or her own pain medication, not the family at the bedside. If your patient is concerned about overdose, mention to the patient the pump is locked and carefully programmed by the nurse to prevent overdose. Do you know what an AV graft is? An AV graft is a dialysis graft. It's called an intravenous graft. It's attached to your dialysis graft during hemodialysis. You will assess your AV graft for positive bruit, positive thrill. My next question to you, do you know what positive bruit is? Do you know what positive thrill is? Positive thrill is a low frequency vibration on palpation. What is a positive bruit? A positive bruit is a rumbling sound listening with your stethoscope. What diet would you order for a dialysis patient? All dialysis patients, the doctor will order a renal diet. What's your priority intervention for a suicidal patient? All suicidal patients should have 1-and-1 sitter at the bedside for safety. Do you know what an NG tube is? An NG tube is a nasogastric tube. How is an NG tube verified after placement? It is verified by chest X-ray. What are your indications for NG tube? NG tubes are placed, it's ordered by the doctor for decompression of the stomach, small bowel obstruction when your patient is admitted, cardinal sign, nausea, vomit, abdominal pain, and discomfort. NG tube patients are always NPO. NPO, nothing by mouth. The tube is placed through the nostril down through to the stomach. So your patients are NPO. This means the medication will be administered down the tube. The nutrition, which is a parenteral liquid nutrition, if it's ordered, will be inserted down the tube. Your patient has diarrhea. What is the first thing you do? You'll ask your doctor for an order for a stool culture specimen. We're trying to culture the stool to identify the kind of bacteria that's present. Most of the times, patient will have C. diff, Clostridium difficile. That's the definition for C. diff. If the patient do not have C. diff, then the doctor will order anti-diarrheal medication, most of the times Imodium. But remember, for diarrhea, first we identify for the bacteria. Bacteria found, doctor orders antibiotics for your patients. Bacteria not found, then we order anti-diarrhea medication. Patient is oriented ×4. What does that mean? Oriented ×1 is person, 2 is place, 3 is time, and 4 is situation. Remember, your Assess your elderly for confusion. If their orientation is changed from a 3 to a 1, identify confusion. Get a urine specimen. Cardinal sign for urinary tract infection for the elderly is confusion. Your patient is confused. We need to identify that bacteria in the urine specimen, and we will be given an order for antibiotics. Please hit your like button, please share, please subscribe. Thank you. Have a blessed day.